Hi guys, today's video we will talk about how to diagnose and cure the yellow fever virus. How to diagnose the yellow fever virus. Diagnosing yellow fever based on signs and symptoms may be difficult because early in its course, the infection can be easily confused with malaria, typhoid, dengue fever, and other viral hemorrhagic fevers. To diagnose your condition, your doctor will likely 1. Ask questions about your medical history and your trip. 2. Collect blood samples for testing. If you have yellow fever, blood can reveal the virus itself. If not, a blood test can detect antibodies and other substances that are specific to the virus. What are the treatment for yellow fever? There are no antiviral drugs have been proven to help in treating yellow fever. As a result, treatment consists primarily of supportive care in a hospital. This includes providing fluids and oxygen, maintaining adequate blood pressure, replacing blood loss, providing dialysis for kidney failure, and treating any other infections that develop. Some people received plasma transfusions to replace blood proteins that improve clotting. If you have yellow fever, your doctor may recommend that you stay inside, away from mosquitoes, to avoid transmitting the disease to others. Once you have yellow fever, you will be immune to the disease for the rest of your life. Preparing for your appointment. Call your doctor if you have just returned from a trip abroad and develop mild symptoms similar to those that occur with yellow fever. If symptoms are severe, go to an emergency room or call 911 or your local emergency number. Here's some information to help you get ready and know what to expect from your doctor. The information gathered in advance. 1. Symptoms in history. Write down any symptoms you have experienced and for how long. 2. Recent exposure to a possible source of infection. Be sure to describe international trips in detail, including the countries visited and the date and contacts you may have with mosquitoes. 3. The health history. Make a list of your key medical information, including other conditions you're being treated and any medications, vitamins or supplements you're taking. Your doctor will also need to know your vaccination history. 4. Questions to ask your doctor. Write down your questions in advance so you can make the most of your time with your doctor. The list below shows to raise questions with your doctor about yellow fever. Do not hesitate to ask more questions during your appointment. 1. What is the most likely cause of my symptoms? 2. Are there other possible causes for my symptoms? 3. What kinds of tests do I need? 4. What treatments are available to help me recover? 5. How long do you expect a full recovery will take? 6. When can I return to work or school? 7. Am I at risk of long-term complications of yellow fever? What to expect from your doctor. Your doctor may ask you a number of questions. Being ready to answer them may reserve time to go over any points you want to talk about deep. Your doctor may ask 1. What are your symptoms? 2. When did you first begin experiencing symptoms? 3. Do your symptoms seem to be getting better or worse? 4. Does your brief symptoms get better and then come back? 5. Have you recently traveled abroad? Where? 6. Are you exposed to mosquitoes while traveling? 7. Do you update your vaccinations before traveling? 8. Are you being treated for other medical conditions? 9. Do you take medication? They are the most common questions your doctor may ask. Thanks for watching. Please check in our next video upload. We'll talk about how you can be free from the deadly virus called AIDS.